Hi folks, well here we are again at the end of yet another week of social distancing and quarantining and self-isolation. Everybody's getting frustrated with it. The county government remains under a limited operation status for longer than I think any of us ever thought we would be doing this. And one of the reasons we're in this situation is because of lack of testing in Georgia and Cobb County. And the big development in the county this week at least was the fact that Cobb and Douglas Public Health was ramping up in a significant way the drive-through testing facility at Jim R. Miller Park. And I met with Dr. Janet Memark, the director of Cobb and Douglas Public Health, on the first day that facility was open for longer hours about the significance of that.
So we've been working with the governor and the Georgia Department of Public Health and been ramping up our testing availability. And so we're really excited because this location has been around for a few weeks now, and now we're going to be able to go ahead and ramp the services up. So we're able to expand the criteria now, and so basically anybody that has any symptoms that are consistent with COVID-19 can come over here and get tested. And those symptoms are shortness of breath, fever, or coughing. So if you have something like that and you fear that you might have COVID-19, you can come and get tested. So the way to do that is to either call the health department at 770-514-2300, or you can go to our website and you can go to the www.cobbanddouglaspublichealth.org website, and then you can go and follow the prompts, and then we'll get you an appointment very quickly. You can still go through your doctor's office route, but there's other ways. You don't actually need any doctor's office or referral to get you in. So we will be doing those here, and then if anybody with symptoms can get tested, and people without symptoms that are first responders or healthcare workers or work in nursing homes or live in nursing homes that may have had an exposure and critical infrastructure as well, they can also get tested as well without symptoms though.
They'll be able to run through as many as 100 people an hour at that testing facility, and they're assisted by members of the National Guard that also showed up this week in fairly large numbers to assist in the logistics of making that happen. So why is testing so important?
Testing is extremely important in this phase of our battle against COVID-19. So previously we weren't able to tell who exactly was getting the illness and how it was exactly spreading. So now this will give us a much better idea. If we can do widespread testing and wider testing, we can have a better idea of how it's affecting our community and where it is. And if we get new pockets of outbreaks or clusters, we can tell what's happening. And so this will help us to, whenever we start talking about reopening our economy and to back off of social distancing, we really need this kind of information to move forward.
And we already mentioned that getting one of those free tests at Jim R. Miller Park is easier to get, but not everybody can get it. You either have to be in one of those target groups or have some of those symptoms, and you have to fill out a questionnaire before you can get an appointment time. And I'll have a link to some of that information in the description to this video.
The questions are just getting some basic demographic data, your name and your address, email. We want to know how we can get results back to you. So that's one of the most important things. And then just the symptoms that you're having and, stuff like that. And then we'll go ahead and just shoot you an appointment within just a few minutes. So it's very quick, and so it makes it so you don't have to wait on the phone or talk to somebody.
So about Jim R. Miller Park, this new testing regimen, what will that look like?
So we've talked about increasing the testing capability, so we're really excited about that, but now we're going to be opening for longer hours before too. So before we were only doing it for a few hours and putting the appointments together. Now we're going to try to go all through the day. So Monday through Friday it'll be 8:30 to 5 o'clock, and then we'll be open on Saturdays too from 9 to 12 as well. But our phone lines will be open from 8:30 or 8 o'clock to 7 p.m. every day, and then on Saturday it'll be 8:30 to 5 o'clock.
Well, and the $10,000 question, or maybe the $100,000 question in this case, is when can our lives go back to normal? And that is a difficult question to answer.
Well, a lot of the projections are showing that our peak is still maybe a couple weeks away for the state of Georgia. I don't have county level information on that, but that's kind of a guide to what we can expect and looking at our kind of hospital volumes and things like that. For Cobb County, I feel like we are, more at a steady state right now, and so we are staying below the hospital capacity, which has been very, very important, but it's still been high, but below hospital capacity. And then number of cases are not rising as quickly quickly as they were before. So that shows us social distancing is really working, and we're very happy about that.
A lot of that depends on the so-called peak of the cases in Cobb County, and it's a little unclear when we will reach that here.
Normal is a hard word to give a date on now. So I think we're going to have a new normal as times progress. So we really need a vaccine, which is still 12 to 18 months away, to be able to go back to completely how we were before. So before that, we're probably going to have to take some baby steps, be able to test as widely as we can. But then I'm really convinced that we're still going to have to do some stuff to be careful. So masks are probably still in the projections, as well as washing your hands as often as you can, and trying not to have gatherings where we're too close to each other until we can get a vaccine. So, or show antibodies if we have a high concentration of people that have been exposed. That might afford us some protection, but that protection needs to be pretty high, a high penetrance to be able to have herd immunity for everybody, and I don't think we're quite there.
And finally, I asked Dr. Memark really about the benefits of having the National Guard now involved in this operation, because again, they've gone from running just a few hours a day to running pretty much all day and now 6 days a week. She says the National Guard, very important.
So I'm really excited and grateful. We have the Georgia National Guards with us, and we're grateful to the governor for sending them to us, because they're going to help in our efforts tremendously. We are ramping up these test sites by several 100% in just a matter of days, and so they are critical to making that happen, as well as helping us with our nursing homes as well. So they're going to go in and support us to do testing in the nursing homes, as well as help our nursing homes to prepare and protect the vulnerable residents that they have.
And if you've been following us, we have been updating our COVID-19 page on cobbcounty.org quite frequently with the latest information. There's also ways you can communicate with us as well. Please check that out, stay informed, be safe, and I know we're all getting tired of this.